Okay, so now we're going to take a look at what we call the shoulder model and also the hip model. Now, what's interesting is sometimes people will get these two models confused with each other. So I'm just going to, before I go into the muscles, tell you how to be able to tell one from the other. First of all, here's the shoulder model. It's bigger. The muscles that are represented are a brighter red color, if you will. And then if you see this structure right here, this is the spine of the scapula, which is, of course, a big landmark that you're going to need to be able to name the muscles on here. So that's the shoulder model. And then you can kind of see here, this is the humerus. Okay? If you look at the hip model, what you're going to see here is the iliac crest. Okay? This would be looking at a posterior view of it. If we turn it around to the front, you can still see the iliac crest, and then you can also see the pubic bone here. So I guess since I've got this one in focus on my camera, I'll start with this one. So now I'm looking at the anterior view, and there's two muscles here that you can see on this model. This is the big iliacus muscle. Here's the iliac fossa on the front of the ilium. That's the big iliacus muscle. It's a hip flexor. And this other muscle that you see right here is the psoas major. It's been cut so that you can really visualize the iliacus. So those are both hip flexors. They bring the thigh up on, if you were like marching, okay, when you brought your thigh up, that would be flexion at your hip. Let's spin this guy around. And now we're looking at the posterior view, okay? One of the things that kind of gives you an idea about the posterior view is this muscle right here that you can see. You can see one end of it is not attached, all right? That's the piriformis muscle, okay? And another sort of hint, if you will, that you're looking at the posterior view is that this is the gluteus medius, okay? The gluteus medius is one of the muscles for intramuscular injection. And you can see that they've cut it right there so that you can visualize underneath it, which is gluteus minimus. And then if we go back down here to piriformis, so here's piriformis, okay? And by the way, gluteus medius and gluteus minimus contribute to extension at the hip. The gluteus maximus, which would be over the top of this, would be, of course, the big muscle for extension at your hip. Again, here's piriformis, okay? And then there's some small muscles here that contribute to what we call lateral flexion at the hip, or turning the femur outward. Here is obturator, okay? Remember the obturator foramen, big hole right here between the two ramuses of the pubic bone? And so it's covered over by the obturator muscle. So there's the obturator. Again, here's piriformis. It's not attached at one end. I mean, in real life, it's attached, of course. And then this little guy up here is the superior gemellus. And at the bottom here, underneath the obturator, is the inferior gemellus. And those are all lateral rotators at the hip joint. They're attached to the big greater trochanter on the femur. All right, let's go to our shoulder model. Okay, so again, this is going to be a posterior view because we can see right here the spine of the scapula. This is coming around. That's the acromial end of it, okay? The vertebral column would be over here. This would be medial, and this would be lateral, okay? So, of course, our rotator cuff muscles are here. The four rotator cuff muscles and one other muscle on this that you should know. So if this is the spine, this would be supraspinatus, above the spine. This muscle is infraspinatus, below the spine. This small muscle underneath infraspinatus is teres minor. Okay, that's teres minor. And when we spin this guy around and we look at the anterior view, this is subscapularis. Okay, remember that subscapular fossa on the front of the scapula? This muscle fills the whole thing. So those are the four muscles of the rotator cuff. Now remember, the muscles of the rotator cuff have a few different functions. They rotate the humerus, both internally and externally. They hold the humeral head in the glenoid fossa. It's another function. And they stabilize the shoulder joint. And then one other muscle that you're going to see here is not a rotator cuff muscle, but it is on this model, and you should know it. And that is teres major. So this one is teres major. See, here's teres minor, it's smaller. And here's teres major, which is larger. Teres major is an arm mover. It's not a rotator cuff muscle. Okay, it's attached to the humerus over here, and it's one of the arm movers. Okay, so again, that's the shoulder model. This is the hip model.